Assalamu alaikum and hello everyone. Hope you all are doing well. I am Dr. Mariam Tahir, CEO and founder of PMC Professionals Hub. Welcome you all to PMC Online Academy. Today we are going to start our first short course on Physiotherapy 360-degree Foundations, Importance and Global Scope. This is a 6-day short course. Today is day 1 and the topic for today is Introduction to Physiotherapy, the Healing Science. The topics we should cover in this first day of short course are: what is physiotherapy, definition, philosophy and principles, evolution of physiotherapy as a medical discipline, the role of physiotherapist in the multidisciplinary healthcare team, overview of physio in Pakistan, recognition, education and registration, global overview, leading physiotherapy councils and associations, WCPT, APT, CSP, etc. This is the interactive segment we will discuss later after the completion of the first day topic. Learning outcome will be: participants will gain a foundational understanding of physiotherapy's core identity and its importance in healthcare. Now, let's start. What is physiotherapy? Definition, philosophy, and principles. First of all, introduction. Physiotherapy is a branch of medical science that helps people restore movement and function when they are affected by injury, illness, disability, or aging. It focuses on healing through physical methods such as exercise, manual therapy, posture correction, and patient education, rather than only relying on medicines or surgery. Physiotherapists are movement experts. They help individuals reduce pain, improve strength and flexibility, and regain independence in daily activities. This is the introduction of physiotherapy. Now move on to definition of physiotherapy. Here are a few simple definitions I would like you to know. World Physiotherapy, WCPT, is basically a World Confederation of Physical Therapy. Defines physiotherapy as a healthcare profession concerned with human function and movement and maximizing physical potential. Simple definition. You should also know that physiotherapy means helping people move better and feel better through exercise techniques and physical treatments. Now, philosophy of physiotherapy. The philosophy of physiotherapy is based on the belief that movement is essential for life and health. When movement is lost or restricted, health and quality of life decrease. Physiotherapy helps restore, maintain, and promote optimal movement and function. What are the core beliefs in physiotherapy philosophy? First is movement is equal to medicine. Movement is the key to health and healing. Second is body can heal itself. The human body has a natural ability to recover. Physiotherapy supports and enhances this healing. And third is holistic approach. In holistic approach, physiotherapy treats the whole person not just the injured part. Okay, and the fourth is patient-centered care. Every patient is unique. Treatment is personalized according to individuals' needs, goals, and lifestyle. Fifth is prevention is better than cure. Physiotherapy not only treats illness but also helps prevent future injuries through education and awareness. Next topic is principles of physiotherapy. The principles of physiotherapy guide how treatments are planned and applied. These are the foundations of good physiotherapy practice. First is assessment and diagnosis. Second is individualized treatment. Third is use of physical techniques. Fourth is education and empowerment. Fifth is prevention and promotion of health. And sixth is evidence-based practice. So first of all, we will discuss about assessment and diagnosis. In this principle, before treatment, physiotherapists perform a detailed assessment to understand the cause of the problem. This includes taking patient history, physical examination like posture, joint movement, strength, flexibility, identifying pain patterns and limitations. What is the purpose of this principle of physiotherapy? To find why the problem exists, not just treat the symptoms. Okay? And the second is individualized treatment. In this principle, every patient has different needs. A physiotherapist designs a personalized treatment plan based on the condition or injury, age and fitness level, patient goals and lifestyle. Example, for back pain, one patient may need posture correction, another may need core strengthening, and another may need manual therapy. Okay? And the third is use of physical techniques. In this principle, physiotherapy uses physical methods instead of drugs. Some common techniques include exercise therapy, like strengthening, stretching, balance training. Next, manual therapy, like massage, joint mobilization, and manipulation. Next, electrotherapy includes ultrasound, TENS, heat or cold therapy. Next, posture correction and ergonomic training. Next, fourth is education and empowerment. In this principle, physiotherapy doesn't stop in the clinic. Patients are educated about their body, posture, exercises, and self-care. This helps them take control of their own recovery and prevents recurrence. Fifth principle is prevention and promotion of health. In this principle, physiotherapy is not only for those who are ill, it also helps healthy people stay healthy. It promotes regular physical activity, injury prevention strategies, lifestyle modifications for better health. And the sixth principle is evidence-based practice. In this principle, modern physiotherapy is based on scientific research and clinical evidence. Physiotherapists stay updated with new studies, techniques, and guidelines to ensure safe and effective care. Now, the evolution of physiotherapy as a medical discipline, our day one's second topic. And the introduction is physiotherapy is not a new concept. Its roots go back thousands of years when physical movement, massage, and exercise were used as methods of healing. Over time, it evolved from simple body exercises to a scientific, research-based medical profession recognized all over the world today. Now, the ancient origins of physiotherapy. Long before the term physiotherapy existed, ancient civilians used movement and manual techniques for healing. First is ancient China and India. Around 2500 to 1000 BC. In this region, ancient Chinese medicine include massage, breathing exercises, and movement therapy such as Tai Chi. In India, the Ayurvedic system used therapeutic massage and yoga to restore physical balance and health. These early methods emphasized natural healing through movement, the foundation of today's physiotherapy. Okay? And the second ancient origin is ancient Greece around 500 BC. The famous Greek physician Hippocrates, known as the father of medicine, first used manual therapy, massage, and hydrotherapy. Hydrotherapy is basically a water therapy, okay? For healing joint and muscle problems. Greek physicians believed that exercise and proper movement were vital for health, and philosophy still followed in modern physiotherapy. Next topic is physiotherapy in the 19th century, birth of a profession. The 1800s marked the official birth of physiotherapy as a medical discipline. The term physiotherapy appears. The word physiotherapy, meaning treatment through physical methods, began to use in Europe. In Sweden, 1813, Per Henrik Link, a Swedish doctor and gymnast, founded the Royal Central Institute of Gymnastics, RCIG, where scientific exercises were taught for medical rehabilitation. This was one of the first organized forms of physiotherapy education in the world. Second is development of manual and exercise therapy. The 19th century saw rapid development in anatomy, physiology, and exercise science. Doctors and therapists started using massage, joint mobilization, and exercise therapy to treat war injuries and paralysis. Next, early 20th century. Physiotherapy becomes recognized professionally. The early 1900s brought major events that changed physiotherapy forever. First is World Wars and rehabilitation. After World War 1914 to 1918 and World War II 1939 to 1945, thousands of soldiers were injured with fractures, burns, and nerve damage. The need for rehabilitation gave rise to trained physiotherapists who helped soldiers walk, move, and live independently again. Physiotherapy became an essential part of hospitals and recovery centers. Next, establishment of official associations. 1921, the American Women's Physical Therapeutic Association, now American Physical Therapy Association, APTA, was founded in 1921. In 1951, the World Confederation for Physical Therapy, WCPT, as I told you before in the start of the lecture, now World Physiotherapy, was formed to unite physiotherapists globally. These milestones made physiotherapy a regulated, respected healthcare profession. Now, late 20th century expansion and modernization. From the 1960s onwards, physiotherapy expanded across the world, like academic growth, technological advancements, and recognition in healthcare. Academic growth, physiotherapy education moved that from diploma to degree and doctor levels, DPT. Research and evidence-based practice became the core physiotherapy training. Technological advancements, introduction of electrotherapy, ultrasound, laser therapy, and exercise machines. Development of specialized branches as neurophysiotherapy, sports physiotherapy, pediatric physiotherapy, women's health physiotherapy. Third is recognition in healthcare. Physiotherapists started working alongside doctors, surgeons, and nurses as part of the medical team. Hospitals, rehabilitation centers, and universities began establishing independent physiotherapy departments. Now, evolution of physiotherapy in Pakistan. Physiotherapy was introduced in Pakistan around the 1950s to 1960s, initially through hospital-based training programs. The School of Physiotherapy, Jinnah Postgraduate Medical Center, JPMC, Karachi, was among the first institutes. Later, many universities launched Bachelor and Doctor of Physiotherapy DPT programs. The Pakistan Physical Therapy Association PPTA and Punjab Healthcare Commission PHC began regulating the profession. Today, physiotherapy is a growing medical field with national and international recognition. 21st century, the modern era of physiotherapy. Physiotherapy is now recognized as an independent healthcare profession in most countries. The focus has expanded beyond treatment. It includes rehabilitation, health promotion, injury prevention, wellness and fitness training. Tele-rehabilitation is online physiotherapy services. Okay, tele means online. Physiotherapists now use digital tools, AI-based rehab devices, and virtual consultations to reach patients globally. So now move on to our third topic for today's day one lecture. The role of a physiotherapist in the multidisciplinary healthcare team. Introduction. In modern healthcare, patients are cared for by a team of different health professionals, not by one person alone. This team approach is called a multidisciplinary healthcare team, where doctors, nurses, physiotherapists, and other specialists work together for the patient's best recovery. Among them, physiotherapists play a vital role in helping patients regain movement, strength, and independence, which are essential parts of total health and well-being. Now, what is a multidisciplinary healthcare team? A multidisciplinary healthcare team, MDT, is a group of health professionals from different specialties who collaborate to plan and deliver the best possible care for patients. Each professional has a unique role, but all share a common goal to improve the patient's physical, emotional, and social well being. Now, the common members of a healthcare team: doctors or physicians. They diagnose and prescribe treatment, and nurses, they provide daily medical care and monitoring. Physiotherapists restore movement, strength, and function. Occupational therapists help patients return to daily activities. Speech therapists treat speech and swallowing problems. Psychologists or counselors provide mental and emotional support. Dietitians guide patients on nutrition and diet plans. Pharmacists manage and advise on medications. Social workers help with family and community support. Next is the physiotherapist role in the healthcare team. Physiotherapists are movement and function specialists. Their main goal is to help patients recover, prevent further disability, and maintain independence in daily life. Let's explore their role step by step. Step 1 is assessment and diagnosis. Physiotherapists perform detailed assessments to understand the patient's physical condition. They evaluate pain, muscle strength, joint movement, balance, and coordination. Based on the findings, they diagnose movement problems and create a personalized treatment plan. For example, after surgery, a physiotherapist assesses how much the patient can move their arm or leg and plans exercises accordingly. Second is rehabilitation and recovery. Physiotherapists play a key role in rehabilitation, helping patients recover from accidents and fractures, stroke or paralysis, sports injuries, post-surgical weakness. They use exercise therapy, manual therapy, and electrotherapy to restore mobility and function. For example, a stroke patient learns to walk again through balance and strengthening exercises guided by a physiotherapist. Third is education and patient empowerment. Physiotherapists educate patients and families about correct posture and movement, home exercises, injury prevention techniques, use of assistive devices, for example, crutches, braces, wheelchairs. This makes patients independent and confident in managing their own health. Next is pain management. Physiotherapists help reduce pain, stiffness, and swelling using physical techniques such as heat and cold therapy, ultrasound and TENS. TENS is basically transcutaneous electric electroneuromuscular stimulation. Manual mobilization and stretching, strengthening and relaxation exercises. Goal, what is the goal? Pain management. Relieve pain naturally without over-reliance on medication. Next is collaboration with other health professionals. Physiotherapists communicate and coordinate with other professionals to ensure complete care. They may work with doctors to update recovery progress or coordinate with nurses for mobility and positioning of patients, and share reports with occupational therapists to continue functional training, discuss mental or lifestyle challenges with psychologists and dietitians. For example, in a rehabilitation center, the physiotherapist updates the doctor about patient progress so medication or treatment plans can be adjusted. Last is prevention and health promotion. In this, the role of physiotherapy is physiotherapists also focus on preventing injuries and promoting health. They conduct awareness sessions on correct body mechanics and posture at work, ergonomics for office workers, exercise programs for elderly people, community fitness and wellness events. What is the goal? Goal is help people stay healthy, active and injury free. Next is role of physiotherapy in different healthcare settings. Setting like hospital, ICU, OPD, wards. Physiotherapist role is early mobilization, post-surgery rehab, breathing exercises. And in rehabilitation center, the role of physiotherapy is long-term therapy, for neurological and orthopedic cases. Setting is sports clinics. Physiotherapy role is injury prevention, fitness training, sports and recovery. Setting is community or home care. Physiotherapy role is home-based therapy, elderly and chronic care. Teaching and research institutes is a setting, and the role of physiotherapy is educating students, conducting research, developing new techniques. Next is the importance of teamwork. Physiotherapists are key members of the healthcare team because recovery depends not only on medicine but also on movement and function. When physiotherapists work closely with doctors, nurses, and others, patients recover faster. Risk of complications decreases. Hospital stays become shorter. Quality of life improves significantly. Now, today's next topic is overview of physiotherapy in Pakistan, recognition, education, and registration. So, introduction. Physiotherapy in Pakistan has grown remarkably over the last few decades, from a lesser known profession to a recognized, respected, and in demand medical field. It plays a vital role in the rehabilitation and recovery of patients suffering from physical injuries, disabilities, and chronic diseases. Physiotherapists in Pakistan now work in hospitals, clinics, rehabilitation centers, sport facilities, NGOs, and academia, contributing greatly to healthcare and patient well-being. Recognition of physiotherapy in Pakistan. Historical development. Physiotherapy was introduced in Pakistan during the 1950s to 1960s, mainly to treat patients with polio and war injuries. The first school of physiotherapy was established at Jinnah Postgraduate Medical Center, JPMC, Karachi. Gradually, other provinces and universities began establishing physiotherapy departments and colleges. Official recognition. Physiotherapy is recognized as a medical and rehabilitation science by the Government of Pakistan. It is considered a distinct healthcare profession, not a sub-branch of medicine or nursing. Physiotherapists are now part of both public and private healthcare systems, providing independent consultation and treatment. Public awareness.